yesterday, temporarily halting the controversial Ebola isolation facility planned for the Laikipia airbase. The Kenyan government has tonight reaffirmed its commitment to the project under a partnership between Kenya and the United States government. Confirming this, the Ministry of Health this evening issued a statement saying that as part of efforts to strengthen Kenya's preparedness against Ebola and other public health threats, the government is establishing a similar facility at a military installation in Laikipia to bolster monitoring, isolation and emergency response capacity, an outright violation of the court order.
Happy that the High Court has issued an injunction against the government establishing an Ebola quarantine center here in Kenya for the Americans.
That court ruling was received with relief by many Kenyans, healthcare workers, civil society groups, and political leaders who had opposed the proposed Ebola isolation facility at the Laikipia airbase. For many, the conservatory orders issued by the High Court signaled that the government will pause the project pending further hearings and public scrutiny. But barely a day later, the government has outrightly chosen to disobey the court order. In a strongly worded statement issued Saturday evening, Health CS Aden Duale has reaffirmed plans to establish the facility, saying the move forms part of Kenya's broader preparedness strategy against the Ebola outbreak currently affecting the Democratic Republic of Congo.
Uganda has closed its...
In the statement, Duale also stated that the government has already established dedicated isolation and treatment facilities at Kenyatta National Hospital, the Kenya National Police Hospital, and Moi Teaching and Referral Hospital. He further revealed that additional preparedness sites have been identified in more than 10 high-risk border counties. And significantly, the ministry confirmed that in partnership with the United States government, Kenya is also establishing a similar facility at a military installation in Laikipia to strengthen monitoring, isolation, and emergency response capacity. According to Duale, the partnership will also support enhanced disease surveillance, laboratory diagnostics, emergency preparedness exercises, medical supplies, and rapid response systems. The Health CS says the investments are intended to strengthen Kenya's overall health security and leave the country better prepared for future outbreaks beyond the current Ebola threat. But even as government officials defended the project, doctors have intensified calls for transparency.
Solidarity forever.
The KMPDU maintained that the public has not been fully informed about the details of the agreement and what it means for Kenyans.
There should be more force, more resources and more experts that are sent to Congo to help the containment. Because we know very well, and this is the reality, that the moment we have a reported case in the country, the moment we have an outbreak in the country, things changes.
The union insists that any decisions with potential public health implications must involve public participation and stakeholder engagement.
The government need to have revamped ICUs in the country. The government need to have equipment in the hospitals. So then we will be having functional hospitals in the country.
Meanwhile, political leaders have joined the growing chorus of concern. Opposition leaders have challenged the government's handling of the matter and demanded greater accountability regarding Kenya-United States arrangement.
The Americans themselves are sending away their own citizens who have been affected by Ebola. Lakini mkora mmoja hapa Kenya, kwa sababu amepatiwa pesa, anasema tuletewe hawa wagonjwa wa Ebola hapa Kenya. Kusema tunapinga hiyo Ebola center to establish in Laikipia County or in any county in the Republic of Kenya.
As the standoff deepens, Kenya is left facing a difficult balancing act between urgency and oversight, between international cooperation and domestic accountability, between preparedness and public trust. And at the heart of it all, three questions now define the national conversation. Is the state securing Kenya's future health or putting the lives of citizenry on the line in the name of health diplomacy? Is the government respecting the authority of the courts or quietly testing its limits? And in the rush to prepare for outbreaks, has transparency become the first casualty?
It was on
Ashley Atieno, NTV.
of one for the
Well, Kenya has strengthened border surveillance with Gate 16 at the Jomo Kenyatta International Airport.